So, ladies and gentlemen, my name is Sharon Whiteman, and I'm part of the executive team of the Lyme Disease Association of Australia. And we're very privileged to have Dobrusia not only as a board member, but also for her contribution in being willing to be available to Lyme patients once a month to answer, those questions that you just need clarity on, and also to increase all of our education base. You'll see some, rules of operation and behavior, very mild ones, in the chat. And I would like to get started by introducing Dobrusia. So Dobrusia is a qualified naturopath and lymph and organ drainage practitioner, passionate about helping people with chronic and complex health issues. She began her professional career as a chemical engineer, and after 12 years working with chemicals, her health has collapsed from a toxic overload. This collapse brought on her previously dormant Lyme disease she contracted in Poland as a child. In addition to this, she developed sensitivity to mold, chemicals, and MCAS. Due to lack of awareness and understanding among medical practitioners in Australia, she spent over 10 years searching for answers and effective ways to heal. She deeply understands the suffering, the frustration, and the helplessness associated with this process. We are so grateful that she would now like to offer her support to those who suffer from Lyme and other complex conditions by empowering them with knowledge and hope. And we appreciate you for attending either live or later down the track with the recordings of these sessions. So Dobrusia, thank you so much for being here.
My pleasure. Thanks so much for introduction, Sharon. So welcome back, everyone. The aim of these sessions here is to not treat or diagnose. It's really to provide you with a knowledge and a bit of help in this really difficult, tricky, unpredictable condition. And you're welcome to join us live or support your questions to Lyme Association Australia email address, and I will try to answer it during next session. So we always start with a little bit of topic we started with a little bit of education on topic related to Lyme disease, and today it's going to be a third part of detoxification series. Detoxification, it's a very important step preceding or really assisting recovery from Lyme disease. It helps us. It will help to handle the symptom, the treatment much better, and have lesser unpleasant side effects. So I'm sharing screen.
I'll just go off camera until we finish this part, Dobrusia, but I'm here.
Yeah. Okay, so screen share. How do I do that? Screen share.
It's just at the bottom in the center below your video. Share screen.
Yeah.
And it'll let you to choose something on your computer.
Yeah. Okay.
There you go.
No, beautiful. Okay. So can you all see the organ detoxification slide?
Yes, looks great.
Right. Okay. So today we'll focus on organ detoxification, specific organ detoxification and drainage. And we have 6 major organs of detoxification. Some of them I have covered briefly last session, but we'll just go over them again because I think it's really important knowledge in dealing with Lyme disease. So we'll start with colon. Colon and stool elimination. It's stool carries one of the biggest amount of waste in the body. So regular bowel movement, full evacuation with no really changes in the stool like mucus or undigested fiber. It's just really crucial for elimination pathways. So some signs of impaired colon or unhealthy colon, it's excessive bloating, lower abdominal bloating, gases, and that changes in the stool appearance. So we can increase how the stool moves, so basically make it move more frequently and quicker through things like fiber, bitter foods, herbs such as licorice or some gentle laxative herbs. I don't recommend strong laxative herbs such as senna. In my opinion, they just too aggressive. So gentle laxative herbs such as yellow dog or licorice, or bitter herbs such as gentian. Another way to improve colon health is microbiome modulation, and that's with prebiotic and probiotics. We can add a bulk to the stool, so basically make it bigger, and that helps with the peristaltic receptors, so makes everything move quicker, and that's mainly soluble, also insoluble fiber, and exercise that is promoting health of any tissue. Hydration, non-caffeinated teas, they count towards hydration, electrolytes, and food, extremely important. Just by eliminating irritating food itself, we can completely change the way how our whole digestive system functions. So removing the inflammatory foods, the most problematic ones are glutens, dairies, soy, sugars. So that's another important part. Next one, it's liver. That's a huge topic. So I will just touch that very briefly. Now, liver in any chronic illness, or pretty much in any illness, deals with enormous amount of toxins. It's number one detoxification organ. It collects all the toxic fragments from bacteria in Lyme disease, bacteria dying off, or they produce toxic metabolites. That goes through phase 2 liver detoxification, well, through all phase 1, phase 2, phase 3 liver detoxification modes, chemicals, pretty much all environmental toxins, they go through liver. Our own metabolic activities, they have to be processed through the liver, and everything else get detoxed through the liver. So liver gets hugely overloaded in most of my clients. So symptoms such as pain and heaviness in upper left, sorry, should be right upper quadrant, alcohol intolerance, fatigue, nausea, sometimes yellow sclera, pale stools, migraines, rashes, allergies, some less specific symptoms. They can be connected to liver, poor liver function. And your blood tests could be still perfectly fine. There won't be any pathology, but the liver function, it can be still affected by the increased toxic load. So there are a number of ways we can support liver function, and I've listed herbs and nutrients first, but what I like to do first is really offload liver, so reduce all the toxic foods, so obviously the non-organic things, herbicides, pesticides, leftovers, so they contain lots of histamines and bacterial byproducts, and they could be toxic for weakened digestive system, and increased foods that support liver function. So I would do first foods as medicine, and then toxin avoidance. That's a general rule for offloading entire body. Then I would do intestinal binders, just because when there is a poor digestive function, dysbiosis, often small intestinal bacterial overgrowth or fungal overgrowth, toxins will be leaking from intestine to the liver and causing huge huge load. Bringing something like intestinal binder that will really offload liver from intestinal toxins. Then after maybe 1 or 2 weeks, when everything gets settled, I would generally bring herbs, gentle herbs and nutrients in very slow amounts. And my favorite herbs are Saint-Mary thistle and clove, artichoke, rosemary, dandelion root, and number of nutrients. Now again, I will bring those herbs and nutrients in really small amounts, because what I notice often is people would have increased detoxification activity and often flare up of the reactions. So that's liver itself. And here is a very interesting but quite complex chart to show different pathways of the liver. For example, phase 2 has glutathione pathway called glutathione conjugation, which is responsible for removing mold, bacterial toxins, heavy metals, and some of the drugs, and also cytokines, inflammatory cytokines, pain inflammatory cytokines. So that's why we put so much pressure, well, not pressure, but NAC and selenium and glutathione are often very often used as a supportive supplements for phase 2 or liver detoxification, just because this first phase, glutathione conjugation, it's one of the most important in Lyme and mold patients. Again, if you happen to experiment yourself with NAC or glutathione, just really slowly, it can cause reactions. Now gallbladder, it's getting more and more attention lately, just because we're learning how much role it plays into detoxification of the fat-soluble toxins, especially mycotoxins. They are stored in gallbladder. So when gallbladder stores biles, and when there is a chronic disease like Lyme or mold, that sludge, that bile become more thicker and turns into sludge and gallstones. And it's more difficult for bile to flow, and that can cause itself dysbiotic environment in the gut, or constipation, or increased accumulation of the toxins in the gallbladder itself. That's why supporting gallbladder function, it's important. Now, gallbladder itself presents with similar symptoms to liver. However, pain, it's also in right upper quadrant, but it's more sharper and it's very localized. So it feels like someone is poking you with needle, and it's very spasmodic and sharp, and often triggered with some fatty foods or fat-containing foods. So with gallbladder, I do like to include the herbs straight away. That doesn't generally cause much detoxification issues. They are the same herbs as or similar herbs than for liver. They're called cholagogue herbs. And they support bile flow. The nutrients are also very effective and important for someone with gallbladder and bile issues. So these are nutrients that here taurine, L-carnitine, choline, phosphatidylcholine, or ox bile. Ox bile, it's like my last result, but I would generally start with L-carnitine, phosphatidylcholine to promote the bile flow. Intestinal binders I will include into gallbladder detoxification, and that's 30 minutes prior eating. Charcoal, it's my favorite one. It's my favorite because it deals with bacterial byproducts and also binds to various, like a broad amount of mycotoxins, and it's also super cheap. So I would do half teaspoon of charcoal 30 minutes prior eating. Once a day, twice a day is better, but once a day it's also good. And we can also promote gallbladder function through bitters and unsaturated fats. Oops. Okay. So lymphatic system, I did talk about that previously, so just going through it again. For lymphatic system, because it doesn't have any pump itself, any type of movement and exercise, it's great. Additionally, things like dry skin brushing, that's my best and most effective daily routine for enhancing lymphatic flow. Now there is a procedure on my website, and you can look up, head there and look up for directions, but generally it's before shower, maybe it takes 1 or 2 minutes, brush towards the heart. But for more directed procedure, I will refer you to my website. And some herbs to support lymphatic function, like nettles, calendula, cleavers, poke root, and they could be purchased in health food store and consumed as a tea, so they don't really need to be added to a stack of supplements that you might already have. Now, just to mention, because the lymphatic system, it's my really area where I specialize in, and I do see when I do lymphatic, manual lymphatic drainage, people experience generally big shift in dealing with their chronic condition. Things are moving much better. They are more freer. There is more vitality, more activity, and generally body offloads the system and it's able to deal with whatever is much better. So scientifically, we have evidence that manual lymphatic drainage increases white blood cell production by 70% up to 1 week from the drainage from the time of the session. So it's a really big big intervention, like a big help towards for the body for dealing with the lymphatic, for dealing with chronic condition. Skin is the largest organ of elimination. Why largest? Because it's the biggest area. Now, promoting sweat, it's a great way to detox skin. For people who don't move much and whose adrenal glands or adrenal function has been really taxed, those people generally don't sweat too much. And obviously, if there is a chronic disease, adrenal glands will be taxed because of the physiological stress of chronic disease. So sometimes it's in this type of scenario, the best way to encourage skin to sweat is through infrared sauna. Infrared sauna itself, the heat from infrared sauna, it's not so sharp and abrasive as other sauna. So infrared rays are able to penetrate much deeper inside the cells and inside the tissues and promote the excretion of the fat-soluble toxins without overtaxing body. Now, lots of people have that approach, the more the better. So they will put sauna for maximum temperature and sit there for 1 hour. I've seen few people doing that, and they had to pay with overtaxed adrenal glands and generally sweating off and excreting too many toxins at once and having a flare-up reaction. So more it's better when dealing with chronic illness. So just 20 minutes and moderate up to 60, 65 degree temperature. If you're sweating, that's great. If there is just a gentle sweat, that's great. But if you sitting there and pouring with sweat for more than 15 minutes and you're starting to develop headaches, that's definitely too much for your system. So just gentle and slowly. So that's for skin. Obviously, hydration, clean water. What I mean by clean water, filtered water, tap water, it's generally not the healthiest source because it has fluoride and chlorine, and if it's rainwater, then it might have blastocystis or other parasites. So just filtered Brita filtered charcoal filter, or one that is Tasmanian water or pure water from Woolies. That's also good option. And lastly, kidney also deal with a high load of toxins, and they collect lots of toxins from the circulation in the body, and the best way to support kidney is basically through good hydration and some Celtic and Himalayan salts, which are full of electrolytes. And even though hydration sounds like a broken record, I see so many people whose answer is often, I don't drink enough. I wish I will. And pretty much every person, when I ask how much do you drink, they say I don't drink enough. So it's always a good reminder to check with yourself, how much water have I drunk? Is the water clean source? Are there electrolytes? Do I need electrolytes? Am I losing electrolytes? So just a pinch of Himalayan or Celtic sea salt for hydration, avoiding caffeine because it's dehydrating, and nice supportive herbs for the kidney itself. It's nettle, ginger, dandelion leaf, or parsley. And diet, alkaline, which is more green vegetable, less red meat. And yeah, that's about that's it for our educational part.
Well done, Dobrusia, and thank you. We do have some questions. So from somebody who's live here today, has mentioned that she gets pain in her posterior abdomen, just anterior to the lower ribs on the back right. Feels like organ pain, and these things are hard to explain. I know anatomically that's right behind the liver and gallbladder. Do you have any comments for this question?
Sharon, let me just go away and turn the lights on because it's getting really dark, and I will come back to you in a second.
Certainly. We also, for everybody's here live, have another question that's come in by email. So if anybody has questions and you can't, attend a certain time, and just to give as an aside, we were alternating daytime and nighttime, but it was getting confusing for people. So we sort of had a mini poll, and evening was the best. So we do recognize that we can't meet everybody's availability. So there you are. We can see you.
Okay. Yes. Sorry about that. All right. We do need to. Could we go back to the question so I can see? Someone else get a pen. Okay. Oh, look, well, anatomically, we on the height. So is it the upper abdomen or middle abdomen? It could be. It's on the height of the kidney. Yeah, look, I really can't answer that. It's really difficult to guess, but on that level we see it could be a liver, it could be a colon, transverse colon, it could be kidney pain, it could be some nerve referring pain. I would really suggest to bring up with your physician and do some imaging investigations to see if there is no abnormalities. Yeah, and also I would like to know a bit more about the nature of this pain, but from what you're saying, there could be any of the organs.
Did you want to add anything to that question, Beck? Okay. Yeah, it's always, it's always good to double check, and then, also maybe jot down patterns when that occurs, or whether it's all the time. And, I appreciate Dobrusia's advice to see a doctor, and also connect with your naturopath or naturopathic support. And we've got, how might one adjust their detox practices if diagnosed with colitis?
Okay, if diagnosed with colitis, I'm not seeing why would you need to adjust the detox practices into this. Okay. Yeah, I don't see any reason to.
Is it too irritating for your colon?
So with colitis,
Does the colitis get worse with detox?
I don't see any detox pathways being aggravating colitis here. Generally, all the detox pathway that I recommend, detox practices that I recommend for Lyme disease are very gentle, and there is nothing that itself will aggravate colitis. Colitis needs a specific diet that's highly anti-inflammatory diet. So that would be my focus for colitis. Definitely binders, because with colitis there will be lots of increased intestinal permeability due to damage to intestinal lining. But the other detox pathway that I discussed, they not necessarily have to be changed. Okay.
Did you want to add to that question at all? Okay, great. And the next question is an infrared sauna suitable for someone with long-term adrenal exhaustion?
So as I discussed, sauna could aggravate adrenal glands, but only when it's done too abruptly, in too high temperature and for too long. So sauna, if it's, I would prefer for someone with adrenal exhaustion, you definitely need to take lots of electrolytes, lots of hydration with electrolytes, such as Himalayan sea salt, even consider vitamin C powder, because that's really building up for adrenal glands, and doing your sauna still, but more in lower temperature and much shorter amounts of times, even before you start sweating, because for adrenal exhaustion it takes really long time to start sweating, and body sometimes has to adjust and eliminate and restore adrenal function before going into detox.
And is there any further clarification you'd like to that question, because you're attending live tonight, in regards to the sauna? So I'll go to the next
Sharon,
question.
was that?
Yeah, I was just asking the person that wrote it.
Mm-hmm.
No, she's good. She or he's good. All good. So the next question is, can you please recommend a video tutorial or a routine for self-lymphatic drainage massage? I currently follow one by a lymphedema specialist on YouTube, and her exercises are good, but do you have one that you recommend for massage, or a worksheet for the massages? I can't afford to pay for lymphatic drainage at the moment. This is about 3 or 4 parts, this question.
Yeah,
That's the first part.
Yeah. Okay. So how do we do that? I do have my favorite therapist that I usually refer to, and she has few video tutorials on self-lymphatic drainage. So how should we share that? Should I find it now, or could we post the link somewhere else?
What's the name?
I think it's called Lymph Drainage by Heather, and she did record these sessions maybe 10 years ago.
Okay.
And yeah, I've been generally recommending her to patients. Now, I'm not sure about, firstly, I would like to know about this person's lymph status, because if there is a lymphedema, then obviously that lymph drainage, lymph technique will be done differently to general lymph congestion. So that's something to consider. But if it's just a lymph support, then things like dry skin brushing, it's perfectly okay and enough to do it yourself in between sessions with the therapist. So all those things that I mentioned, like as dry skin brushing with a brush, rebanding on trampoline, exercise. There is one very important and successful and great exercise supporting lymph system, and that's basically breathing out all the air we have in lungs. So feeling the abdominal squeeze. So maybe I'll stand up to demonstrate. So cisterna chyli, that's a reservoir for the lymph, and it's located about just around the area of abdomen, upper abdomen. So when we breathe in and squeeze out all the air, that's where the cisterna chyli gets the movement of pumping and excreting all bile. So what I tell my patient is just blow off all the air that you have in your lungs, and that creates that squeezing movement of cisterna chyli, and that helps to draw the stagnant lymph from all the deeper abdominal connections. And to do that maybe twice a day for 10 times. It does feel like doing abdominal crunches, but it's more like excreting, blowing out all the air and feeling that squeeze in the abdomen. And of course, I will also share the link to self-abdominal drainage, which Heather shows. Maybe I will post it. Maybe we can just post it on Facebook, in Facebook group.
Yeah, and I can put it in the comments on the YouTube video when we upload it as well. And there's another part of the question. Are there any particular topical oils that are best for lymphatic drainage? I currently use arnica oil that I make myself, and it works good for inflammation. But I'm wondering if there's any topical carrier oil or essential oil that works more targeted for the lymph system.
I used to use essential oils when I was doing lymph drainage. So there are some oils that are specific for that. So my favorite were ginger, thyme, and frankincense. And the way you do it, I would just use one oil at the time, because they could sometimes cause some reaction, although it is rare. So I'll take a few drops and mix it equal amount with jojoba oil or even olive oil, and apply that to a pressure point. So these are on the wrists, on the crest of the elbows, in all the terminus lymph area, behind, for example, behind the ear. That's really good point, and on the tip of the neck. and just gently, you can either apply or massage by doing few circles. So these are essential oils. I also sometimes use homeopathics applied on the same points, and they are homeopathics by Hill or Pekana. They are like specific organ or lymph drainage remedies.
Awesome.
Mm-hmm.
And whoops, lost my screen here for some reason. The next part of the question is, I've also just started a parasite cleanse for the second time in 12 months as I seem to have a big infection. I want to ask why I get more itching symptoms during the cleanse. Is it because the parasites are getting stirred up? Or, and I also experienced getting horrific die-off symptoms, but I expected that as I had the same last time. But I'm just curious about the process and especially the itching.
Mm-hmm. So I'm not sure about the infection and what infection this person refers to.
Parasites?
Parasite infestation. Okay. So the die-off reaction, it's usually when we're doing something too quickly and too abruptly. So I would suggest maybe doing a pause, decreasing a dose, making sure your elimination organs are working really well, especially colon. It's moving really fast, so there is no no diet to decrease the die-off reaction. In terms of itching, increased itching. So, look, it's a possibility of die-off reaction because itching is a primary reaction for parasites, but it's also a fungal symptom related to fungal overgrowth. So maybe is you displacing one microorganism and another microorganism is growing, but increased itching in my feeling is that will be one of the die-off reactions or just reaction related to dealing with the parasites. However, now I'm thinking we don't know what's really itching. Is it skin itching, or do we have more information on that?
No.
No. Okay. So look, if it's anal itching, then probably it's a form of die-off reaction or some other being displaced. If it's skin itching, that might mean that liver is overloaded, and how the toxins from die-off toxins, Herxheimer reaction, are being pushed out on the skin. And I would pause and focus more on decreasing liver load and then doing parasite cleanse.
Okay, thank you. And the final question that's come in by email is, if this infection is very big, how long and how many treatments does it usually take to eradicate them all? So I know there's people that there's quite a bit of movement around where people are having, doing multiple or series of parasite cleanse until they feel clear. What's your advice, Dobrusia?
It's really, really difficult to say. It's very individual case, and we don't know which parasites, and we often don't know which parasites. I would be judging by the symptoms. I have heard of people who have done the parasite cleanse for 2 years. And generally for a healthy person, it's 1 or 2 rounds. So we do it in rounds just because parasites have different phases of life, and when they lay their eggs and become full parasites, 2 or 3 rounds would be maximum. So up to 3 months. But again, I will be judging by the symptoms. It's really symptom based, because there is no test that could shows us that will show us how amount of parasites, which parasites are present, which not.
Awesome. I think that's the extent. Is there any more questions here live? The extent of what's come in by email. And I just want to mention that we're getting anywhere from 40 to over 100 views of these videos on YouTube. So, if you're interested in this and you're asking for support and wanting more knowledge and to, sometimes take the reins into your own hands for some of your support for your health situation, know that you're in good company, and that will continue. And these can be, if you go back, we'll do our best to have the topics in the title. That's not my forte, really. I forget things, but you can search back on the email if you want to, or on the videos, and if you want to touch up your education. And I'll just add that the website for the lymphatic drainage massages to do yourself is www.massagebyheather.com, and then you can find her YouTube videos by that, and I'll put that in the comments on the YouTube when we upload it.
Oh, well done, Sharon.
If the gods help my internet. So we might be complete, Dobrusia. I think there's no more questions live. And that was a really informative one for many people. I'm sure that came in by email. So thank you.
My pleasure.
It was Esther that sent that. Yeah. So we'll complete for tonight. Hope everybody has a lovely evening, and all prayers for your continued improvement and recovery of your health. Thanks everyone for being here. Good night.
Good night.
Thank you.
Thank you.